Our attention to COVID-19, and the Ghana Medical Association GMA says the greatest threat to COVID now is the unvaccinated. According to the General Secretary, Dr. Titus Bayo, the GMA welcomes the easing of restrictions, but Ghanaians must be on guard.
President Akufo-Addo announced for the first time since the pandemic that the wearing of face masks is no longer mandatory. He also said all in-person activities, such as those that take place in churches, mosques, conferences, workshops, private parties and events, cinemas and theatres may resume at full capacity as long as the audience and all participants are fully vaccinated. The Ghana Medical Association welcomes the announcement, but with skepticism. General Secretary of GMA, Dr. Titus Bayo, expects all eligible to be vaccinated.
Some of our countrymen and women are refusing to vaccinate. They are posing perhaps the greatest threat as far as this condition is concerned now. And we have to get all of those people to agree to vaccinate. So failure of people to vaccinate means that there are still a lot of susceptible hopes in our environment. Another thing is that we do not know what will happen with change in weather, with new variants that may come, that may be more transmissible. If ongoing surveillance pick up anything that shows that there are new variants that are more transmissible or can cause more havoc, then I'm sure the scientific community, we will not hesitate to reinform the nation and get everybody on board.
Meanwhile, an associate professor from the School of Public Health, Richmond Neokai Aite, says Ghanaians do not have absolute protection yet from the virus.
There's also something that is different about our circumstance. In many of those countries, they've hit either close to 70% vaccination rate with additional boosters. And that gives them a lot more protection, because what we know about these vaccines is that the immunity that it gives you, over time, it reduces.
Meanwhile, the Executive Director of the Africa Center for Health Policy Research and Analysis, Dr. Thomas Anaba, wants government to manage the transition. He tells TV3 event organizers have no means to monitor compliance, particularly during outdoor events.
Most of the events in our country are held in open areas. So it's going to be difficult for you to check who has vaccinated, who hasn't vaccinated. Those who have vaccinated, not everybody carries along his card, unless they advise everybody to carry his card anytime he's going to an event that would be in an enclosed place. And we need to get what we call gadgets that will really detect and then scan the card to really see whether it's authentic or it is not authentic. Because we are told some people have been able to devise their own cards that they're vaccinated, which of course we know perhaps they have not been vaccinated. So it's going to be difficult for anybody to control any gathering to ensure that everybody has vaccinated. I think that was a request by the president that is going to be too much for event organizers. What our advice is that they keep encouraging people to take the vaccine and make it available at all gathering points.
So the announcement by the president about the revision of the COVID protocols has been greeted by a number of people with different reactions. Let's find out what the numbers are looking like for Ghana right now. We know that at least 160,925 cases of the coronavirus have been recorded in Ghana. And out of that, we have some 1,445 people losing their lives to the virus. So far, 13,045,826 have had total doses administered, or they have taken their vaccines fully. Those who have fully taken their vaccinations are in excess of 5,070,306. That's about 16% of the Ghanaian population. And out of that, some 8.9 million, or almost 9 million, Ghanaians or adults have had at least one dose of the vaccines. And those who have gone for booster jabs are about 158,000. And this data is as of the 24th of March. when you go to Kenya, which is also on the African continent, they seem to have recorded more cases than Ghana. They had about 323,000 confirmed cases. And out of that number, 5,647 have died. Those who are fully vaccinated are over 7 million, about 7,995,000, which is about 29.3% of the Kenyan population. And those who have had total doses administered, I mean, the total number of persons who've been administered, who have taken the vaccine, I should say, about 17,439,000. And that data is also just about 4 days old, so quite fresh. Now, when you go to Europe, one of the countries that took quite a hit from the virus will be the United Kingdom. And these are their numbers as of the 25th of March. 20,613 and over persons were infected with the virus. Out of that number, 164,282 have died. Those who have at least taken the first dose are about 52,759,000 and over. The number that have also gone for at least their second dose, we have 49,352. And those who have gone for booster jabs, we are talking about some 38,718,000.